Hey people, it's Niles Toki. Now, I like to do psychology videos from time to time, so I'm doing one again. Now, before I start, I'll say a disclaimer. I'm not a mental health professional, and this video is for entertainment purposes. If you have mental health issues, then you should seek a qualified mental health professional. Alright, this is from Psych Central, Cognitive Behavioral Therapy. Cognitive behavioral therapy is a short-term, goal-oriented psychotherapy treatment that takes a hands-on, practical approach to problem solving. Its goal is to change patterns of thinking or behavior that are behind people's difficulties and so change the way they feel. It's used to help treat a wide range of issues in a person's life, from sleeping difficulties or relationship problems to drug and alcohol abuse or anxiety and depression. CBT works by changing people's attitudes and their behavior by focusing on the thoughts, images, beliefs, and attitudes that are held, a person's cognitive processes, and how these processes relate to the way a person behaves as a way of dealing with emotional problems. An important advantage of cognitive behavioral therapy is that it tends to be short, taking 5 to 10 months for most emotional problems. Clients attend one session per week, each session lasting approximately 50 minutes. During this time, the client and therapist work together to understand what the problems are and develop new strategies for tackling them. CBT introduces patients to a set of principles they can apply whenever they need to, and that will last a lifetime. Cognitive behavioral therapy can be thought of as a combination of psychotherapy and behavior therapy. Psychotherapy emphasizes the importance of the personal meaning we place on things and how thinking patterns begin in childhood. Behavioral therapy pays close attention to the relationship between our problems, our behaviors, and our thoughts. Most psychotherapists who practice CBT personalize and customize the therapy to the specific needs and personality of each patient. The history of cognitive behavioral therapy. Cognitive behavioral therapy was invented by psychiatrist Aaron Beck in the 1960s. He was doing psychoanalysis at the time and observed that during his analytical sessions, his patients tended to have an internal dialogue going on in their minds, almost as if they were talking to themselves, but they would only report a fraction of this kind of thinking to him. For example, in a therapy session, a client might be thinking to himself, he, the therapist, hasn't said much today. I wonder if he's annoyed with me. These thoughts might make the client feel slightly anxious or perhaps annoyed. He or she could then respond to this thought with a further thought. He's probably tired, or perhaps I've been talking about the most important things. The second thought might change how the client was feeling. Beck realized that the link between thoughts and feelings was very important. He invented the term automatic thoughts to describe emotion-filled thoughts that might pop up in the mind. Beck found that people weren't always fully aware of such thoughts, but could learn to identify and report them. If a person was feeling upset in some ways, the thoughts were usually negative and neither realistic nor helpful. Beck found that identifying these thoughts was the key to the client understanding and overcoming his or her difficulties. Beck called it cognitive therapy because of the importance it places on thinking. It's now known as cognitive behavioral therapy, CBT, because the therapy employs behavioral techniques as well. The balance between the cognitive and behavioral elements varies among the different therapies of this type, but all come under the umbrella of term cognitive behavioral therapy. CBT has since undergone successful scientific trials in many places by different teams and has been applied to a wide variety of problems. The importance of negative thoughts. CBT is based on a model or theory that it's not events themselves that upset us, but the meanings we give them. If our thoughts are too negative, it can block us seeing things or doing things that don't fit. This confirms what we believe is true. In other words, we continue to hold on the same old thoughts and fail to learn anything new. For example, a depressed person may think, I can't face going into work today. I can't do it. Nothing will go right. I'll feel awful. As a result of having these thoughts and believing them, they may well ring in sick. By behaving like this, they won't have the chance to find out that their prediction was wrong. They might have found out some things they could do, and at least some things that were okay. But instead, they stay at home, brooding about their failure to go in and end up thinking, I've let everyone down. They'll be angry with me. Why can't I do what everyone else does? I'm so weak and useless. That woman probably ends up feeling worse and has even more difficulty going to work the next day. Thinking, behaving, and feeling like this may start a downward spiral. This vicious circle can apply to many different kinds of problems. Where do negative thoughts come from? Beck suggested that these thinking patterns are set up in childhood and become automatic and relatively fixed. So a child who didn't get much open affection from their parents but was praised for schoolwork might come to think, I have to do well all the time. If I don't, people will reject me. Such a rule for living, known as a dysfunctional assumption, may do well for the person a lot of the time and help them to work hard. But if something happens that's beyond their control and they experience failure, then a dysfunctional thought pattern may be triggered. The person may then begin to have automatic thoughts like, I've completely failed. No one will like me. I can't face them. Cognitive behavioral therapy acts to help a person understand that this is what's going on. It may help him or her to step outside their automatic thoughts and test them out. CBT will encourage the depressed person mentioned earlier to examine real-life experience to see what was happening to them or to others in similar situations. In light of a more realistic perspective, She may be able to take the chance of testing out what other people think by revealing something of their difficulty to friends. Clearly, negative things can do happen, but when we are in a disturbed state of mind, we may be basing our productions and interpretations on a biased view of the situation, making the difficulty that we face seem much worse. CBT helps to correct these misinterpretations. What does the therapy treatment look like? Cognitive therapy differs from many other types of psychotherapies because sessions have a structure, rather than a person talking freely about whatever comes to mind. At the beginning of the therapy, the client meets the therapist to discuss specific problems and to set goals they want to work towards. The problems may be troublesome symptoms such as sleeping badly, not being able to socialize with friends, or difficulty concentrating or reading or work. Or they could be life problems such as being unhappy at work, trouble dealing with an adolescent child, or being in an unhappy marriage. These problems and goals then become the basis for planning the content of sessions and discussing how to deal with them. Typically, at the beginning of a session, the client and therapist will jointly decide on the main topics they want to work on that week. They will also allow time for discussing the conclusions from the previous session, and they will look at the progress made with the homework the client set for him or herself last time. At the end of the session, they will plan on another assignment to do outside the sessions. Doing homework. Working on homework assignments between sessions in this way is a vital part of the process. What this may involve will vary. For example, at the start of the therapy, the therapist might ask the client to keep a diary of any incidents that provoke feelings of anxiety or depression so they can examine thoughts surrounding the incident. Later on in therapy, another assignment will consist of exercise to cope with different problem situations of a particular kind. The importance of structure. The reason for having this structure is that it helps to use the therapeutic time most effectively. It also makes sure the important information isn't missed out. The results of the homework, for instance, is that both therapist and client think of new assignments that naturally follow on from the session. The therapist takes an active part in structuring the sessions to begin with. As progress is made and clients grasp the principles they find helpful, they take more and more responsibility for the content of the sessions. So by the end, the client feels empowered to continue working independently. How does it differ from other therapies? Cognitive behavioral therapy also differs from other therapies in the nature of the relationship that the therapist will try to establish. Some therapies encourage the client to be dependent on the therapist as part of the treatment process. The client can then easily come to see the therapist as an all-knowing, all-powerful. The relationship is different with CBT. CBT favors a more equal relation that is perhaps more business-like, being more problem-focused and practical. The therapist will frequently ask the client for feedback and for their views about what is going on in therapy. Beck coined the term collaborative empiricism, which emphasizes the importance of client and therapist working together to test how the ideas behind CBT might apply to the client's individual situation and problems. Who benefits from CBT? CBT can be an effective therapy for the following problems: anger management, anxiety and panic attacks, child and adolescent problems, chronic fatigue syndrome, chronic pain, depression, drug or alcohol problems, eating problems, general health problems, habits such as facial tics, mood swings, obsessive compulsive disorder, phobias, post-traumatic stress disorder, sexual and relationship problems, and sleep problems. There is a new and rapidly growing interest in using CBT together with medication with people who suffer from hallucinations and delusions, and those with long-term problems in relating to others. It's less easy to solve problems that are more severely disabling and more long-standing through short-term therapy. People can often learn principles that improve their quality of life and increase their chances of making further progress. There's also a wide variety of self-help literature. It provides information about treatments for particular problems and ideas about what people can do on their own or with friends and family. See further down. Okay, I hope you've enjoyed this and found it helpful. I skipped a few things for the purpose of saving time, but I'm going to leave this article in the description so you can read it yourself and a few others relating to it. So please comment, rate, share, and subscribe. If you would like to support this channel, I'll leave my GoFundMe in the description, and I'll leave my Instagram there as well if you'd like to follow me there. Peace.